Hi there, and welcome to Lesson 1.2 in taking a closer look at healthcare practices. In this lesson, you will learn how each health professional's roles plays an intricate part in your healthcare. This tutorial is a continuation of the last as it investigates how each staff member works together to support patients in need of medical treatment. This video may go a little fast, so if you haven't done so already, have the presentation notes in front of you. And be sure to watch the video all the way through for the first time, and then go back to the parts that you need more clarity on. And after completing this lesson, you will know how to identify service providers and understand how each staff member helps you to complete appointments. And our lesson takeaways are as follows: to be able to discern the makeup of the medical practice and how to seek care according to needs, to be able to group clinical staff and administrative staff roles and direct our concerns and questions to the right professional, as well as understand why clinics are created to solve a community need. In order for us to achieve our knowledge goals, we must first look at the general structure of the medical practice, and then look at the staff that make up the medical practice, and then see how healthcare practices are created. Now let's begin this lesson by first defining what is a medical practice.
A medical practice is a place that focuses on the care of outpatients. Medical practices can be privately operated or publicly managed, while the focal point concentrates on the treatment of acute and chronic illnesses and provide preventative care and health education to people in need.
Now let's take a look at the structure of different kinds of medical practices. Because today,
walking into a technology-based medical practice may seem a little sophisticated at first. But after you revisit the office a couple of times, you will see how the technology plays an important role as to how you navigate through the clinic. From the small private practice to the large world-renowned hospitals with committees, you will be able to see how all of the professionals have dedicated themselves to create an entity for patients, like you and me, as a safe haven for wellness, so that we can focus on our job, which is getting back to health. Here, I have created a staff flowchart of the typical medical practice so that we can categorize rendered services into two groups. The first one being clinical and the second being administrative.
And now let's look at the clinical staff.
The clinical staff works in the area located in the back of the office, which is referred to as the treatment or clinical area. These individuals usually wear scrubs and can answer specific health and physiology questions that pertain to you, your treatment plan, and any compliance issues that relate to your care.
And now let's move on to the administrative staff.
Whereas administrative staff members are office support, and they are typically your first and last point of contact. These workers can wear scrubs or office attire. They are there to answer questions about billing, office hours, scheduling concerns, standard office protocol, and general information about parking.
And now, let's check out how the healthcare system is uniquely made for us.
Every healthcare entity is uniquely designed around its community, so that pharmaceutical companies, medical device manufacturers, organizations such as the CDC and FDA, as well as protectors like the government, can all work together to get us the right healthcare when we need it.
And that concludes our video for today in taking a closer look at healthcare practices and how, just by better understanding its makeup, allows us to become better participants in our treatment. Join me in the next lesson, where we will learn how healthcare communication impacts our experiences and what we can do to make them better.